now hand over to Stefan to talk to us about the European Child Guarantee. Thank you, Stefan.
Thank you. Thank you very much for invitation. Quite surprisingly, I did not prepare a PowerPoint because I think that it is useful to have a look at the full text of the Child Guarantee recommendation, and usually with PowerPoints, it ends the way that we have the PowerPoints, but we don't see the entire text, the entire reasoning behind it. So as an experiment, I prepared for this meeting by reading the recommendation, which obviously I should have known by heart because this is the file on which I have worked for the past more than 4 years. But which in any case, it is useful to refresh, especially as the task for today was to prove that it is evidence-based policy. And this evidence base predates the Child Guarantee by several years. So in 2013, the European Commission has issued a Commission recommendation, Investing in Children, Breaking the Cycle of Disadvantage. This title is very significant because first it shows that the approach has been that spending money on family policies and education and other policies for children is not a spending, but it is a spending, but it is investment which brings back benefits to societies in longer term. In that recommendation, Commission asked the member states to look at 3 aspects: at whether children have access to adequate resources, and this, since children live usually in families, should be through families having enough money, let's put it simply and bluntly. The second aspect, the second pillar which the Commission pointed to was access to services of high quality, and those services are predominantly, if you ask what those services are, then there is early childhood education and care, education, healthcare, and so on. And then the third aspect of the recommendation was to strengthen child participation. And this approach, for the recommendation had been in force for several years. But there was a feeling a few years ago that it needs to be strengthened with a stronger policy message. And hence the announcement by the then new President of the European Commission, Ursula von der Leyen, in her political guidelines back in 2019, that she would issue Child Guarantee. The name was kind of borrowed from Youth Guarantee, which was a big success of previous years. And to guarantee that every child in Europe has access to basic rights like education and healthcare. This is what she mentioned. But when working on details, we kept the approach of the Investing in Children recommendation, specifying what the services are. So this Child Guarantee was published by the European Commission together with EU strategy on the rights of the child. So the strategy on the rights of the child took care of the participation aspect, and I believe it will be discussed more in details very soon. And the access to resources is basically anything else what Commission, DG Employment and other parts of the Commission are doing in terms of social support, minimum income, minimum wages, and so on and so on. And Child Guarantee looked at the aspect of access to services. And those services which we focused on were early childhood education and care, education and school-based activities, healthy meal every school day, and healthcare, as well as healthy nutrition in general, so not only at school, and adequate housing. I divided those 6 items into 2 parts because the first 4 should be delivered free of any cost to children in need who are defined as children at risk of poverty or social exclusion. This is a strong political commitment because looking at the incidence of the risk of poverty or social exclusion across the EU, we see that it has been around 25%, so 1 in 4 children. And the Council recommendation, this is the strengthening of the political aspect, because this time it was the Council, so all member states coming together and agreeing, so without any dissent in terms of voting, that this recommendation should be issued as a Council recommendation. So all member states agreed to recommend to each other to provide those 4 things: early childhood education and care, education and school-based activities, healthy meal each school day, and healthcare for free to all children who might be at risk at poverty or social exclusion. Also, the notion of the risk is that we are not saying that those children for sure are poor and deprived. It is that, well, looking at the situation, at the level of incomes of their families, at the labor market situation of their parents, they might be at risk. And because they might be at risk, they should be given special attention by the public authorities. Why those services? Here comes the evidence base. On early childhood education and care, it has been proven by various research from various parts of the world that if it is of good quality, then it has a positive impact on educational achievement of a child long life. So if you go to a kindergarten, you're more, well, obviously it is all statistics, but statistically you are more likely to do well, or your scores statistically are better than if you didn't go to, if you didn't attend childcare. And now some people say, well, but many parents are very committed. No one is as committed to their children as people in childcare facilities, and that's obviously true. But the research also has shown that this advantage of being part of childcare is especially strong for children from disadvantaged backgrounds. So if your general skills level is not that high, you are, and also it's basically you're a disadvantage, then it seems quite obvious that the kind of education or that you might provide to your child in early childhood education, it might be not as good as by highly skilled professionals. So that's why the Child Guarantee recommendations put stress on saying high quality early childhood education and care. So this is what needs to be provided. Then school-based activities. This is a similar story. Children should not only participate in schools or classes, but also should have access to cultural and sport activities, so all kinds of socializing. And then to that, a very basic thing. And here, the evidence base comes from, medical sciences. So the brain is the most energy-consuming organ in the human body. And in order to be able to study well and efficiently, beginning, at a very early age, even in preschool settings, children should be well nutritioned. So they need to have something to eat for their brain to be able to get the knowledge which is being passed to them. So that's why the recommendation says provide at least one healthy meal each school day to all children in need. And then Another element, healthcare. It is, in most European states, healthcare is free for all children, in most EU member states. There are some gaps which the recommendation asks the member states to address, but also there are gaps like not so much in the formal way, so whether there is an entitlement, but there are also gaps in delivery. So that's why the recommendation puts attention also on this aspect. And then the remaining two things which the recommendation asks the member states to provide for children in need. Healthy nutrition. Here it is not so. It's not only about providing food, because this is the part on school meals, but also about developing healthy habits. So here, the example, something which has been going on for quite many years, started before the Child Guarantee, is the EU school milk, fruit and vegetable scheme. Those are snacks, so not really meals, but the idea is to get children used to consume an apple, a few carrots, something like some dairy product as a snack. And in this way to develop a habit of eating healthy. And also the recommendation makes reference to advertisement of unhealthy foods, which should be prohibited at least in the school settings. And this is also an important aspect. And then adequate housing. This is very, very important. It figures high on the agenda of this commission, because if you listen to the political guidelines of last July, President von der Leyen, when reappointed, was mentioning tackling the housing challenges, so to say. And this obviously has an impact on the situation of children. So space, a place where a child can study and do their homework is an important aspect. I guess I have like 2 minutes, right? So now on like the most interesting part, because what I have said so far is like I guess obvious to many people in this room. First, implementation. So we asked the member states, we prepared recommendation which the Council issued, asking the member states to prepare action plans how to implement Child Guarantee. All member states have prepared such plans. Those plans are public. You can see them on the website of the Commission. There has been a delay for several member states for various reasons, but we see that commitment is everywhere. So member states have prepared the action plans. Also, the recommendation asks the member states to report every 2 years on progress. This is quite tall order, so not all Council recommendations have such frequent reporting. And here also most member states have delivered. So by now we have received 17 reports from the first 2 years of implementation. The countries the reports which are still pending, or countries which are late, are the same which delivered the action plans later than expected. So in a way, it keeps this 2 years rhythm of reporting. And those reports are quite comprehensive and honest. So this is a good sign that member states take it seriously. And then there is a very close follow-up at the Commission side. So we look in the reports. We look in the reports of civil society, and here we also count on your inputs and situation in particular member states, how it is going, and we are in constant contact with child guarantee coordinators to discuss various aspects of implementation. This is because the situation varies a lot between member states. So in some member states, the most vulnerable children who should be helped first with child guarantee are children in rural areas. In other member states, those are children with migrant background living in large cities. In some member states, we see that the general socioeconomic trends lead to the incidence of the risk of poverty among children going down. In other member states, we see that it is unfortunately going up. So all this is taken into account. We address it by like an individual basis with the member states, looking at the challenges which they themselves identified, and the policy levels and the policy measures that we can that we have at the European level, both in the social and employment domain, in DG employment, and in other DGs like EAC and JUST. Thank you. I'm afraid I was a bit too long, but.
Thank you, Stefan. And I think it's probably